The goal of this video lecture is to review the different mood disorders, including both depressive and bipolar disorders, and discuss the ways that these disorders are differentiated from one another. So remember that when we're talking about mood disorders, we're talking about disorders that are characterized by deviations from typical mood states, or what we might call euthymia. When we're talking about mood, we're talking about sets of subjective emotional or affective experiences, behavioral patterns, and patterns in cognition that tend to co-occur. So our depressive disorders are characterized by mood states that are low relative to a euthymic mood state, and our bipolar disorders are characterized by mood states that are elevated compared to a euthymic mood state. In thinking about our depressive disorders, we can define them in comparison to our prototypical depressive disorder, major depressive disorder. So remember that the DSM criteria for a diagnosis of major depressive disorder include that the individual needs to demonstrate at least 5 of the 9 symptoms. Those include mood symptoms such as subjective depressed mood or anhedonia. They include somatic symptoms such as changes to appetite or weight or sleep dysregulations. And they also include cognitive symptoms such as problems with concentration or attention and thoughts of suicide or death. So an individual needs to demonstrate 5 of those 9 symptoms for a duration of at least 2 weeks. The symptoms need to be present for most of the day, nearly every day during that 2-week period. The symptoms need to cause distress or impairment to the person experiencing those symptoms, and the symptoms can't be attributable to a substance or medical disorder. So if we consider major depressive disorder our prototypical depressive disorder, we can define persistent depressive disorder, also called dysthymia, in relation to major depressive disorder. And the primary difference between persistent depressive disorder and major depressive disorder is the severity of the symptoms and the duration of the symptoms. So dysthymia is characterized by persistent, low-grade depressive symptoms. So persistent means that the symptoms of dysthymia may last for longer than required for a major depressive disorder. So in order to meet criteria for a diagnosis of dysthymia, an individual needs to have been experiencing symptoms for a 2-year period of time, and during that 2-year period of time, they can't have experienced a period of more than 2 months where they were not experiencing depressive symptoms. So dysthymia is characterized by persistent depressed mood over at least a 2-year period of time. However, the severity of the depressive symptoms required for a diagnosis of dysthymia is not as severe as required for a diagnosis of major depression. For example, an individual with dysthymia might experience poor appetite, low energy, or poor concentration or feelings of hopelessness, but they may not meet full criteria for a major depressive episode. So persistent depressive disorder, or dysthymia, is less severe than major depressive disorder, but longer lasting. The other depressive disorder that we'll discuss, premenstrual dysphoric disorder, also differs from major depressive disorder in terms of its time course. So premenstrual dysphoric disorder is an interesting mood disorder because the onset of mood symptoms is related to a specific event. In this case, the onset of menses. So premenstrual dysphoric disorder is a disorder that women experience where the onset of mood symptoms and related symptoms is clearly linked to a woman's menstrual cycle. So premenstrual dysphoric disorder can be diagnosed when a woman experiences symptoms during the week leading up to the onset of menses, when symptoms begin to resolve during menstruation, and when symptoms are absent in the week following menstruation. These symptoms can include depressive symptoms, but the mood symptoms of premenstrual dysphoric disorder can also include mood symptoms like irritability, anxiety, mood lability, so very reactive mood or very intense mood. So the kinds of mood symptoms associated with premenstrual dysphoric disorder are broader than the mood symptoms that characterize major depressive disorder. So premenstrual dysphoric disorder differs from major depressive disorder both in terms of the nature of the mood symptoms, that we can also have other abnormal mood experiences in addition to the depressive symptoms, and also because of the timing of symptoms, rather than seeing them over a persistent 2-week period of time, we're seeing them linked to the menstrual cycle. And in order to meet diagnostic criteria for the disorder, this needs to be true for most of the menstrual cycles that a woman experiences, over a 12-month period of time. So those are our depressive disorders, and all of these disorders are characterized by mood states that are low relative to a euthymic or neutral mood state. Our bipolar disorders are characterized by elevated mood states. And those elevated mood states can either be characterized as manic mood states or hypomanic mood states. And mania and hypomania can be distinguished from one another in terms of both the severity of symptoms and the level of functional impairment that they cause, and in terms of the duration of the symptoms that are experienced. So both mania and hypomania are characterized by the same set of elevated mood symptoms. Those might include inflated self-esteem or grandiosity, a decreased need for sleep, an individual being more talkative than usual or exhibiting pressured speech, racing thoughts or racing speech, distractibility, an increase in goal-directed activity, or excessive involvement in what the DSM calls activities with a high potential for painful consequences, such as unrestrained shopping or sexually promiscuous or risky behavior. For both mania and hypomania, an individual needs to exhibit at least 3 symptoms in addition to elevated mood. So the symptoms that an individual needs to exhibit to be diagnosed as having a manic episode or a hypomanic episode don't differ from one another, nor does the number of symptoms required differ between mania and hypomania. One key difference between mania and hypomania is that mania lasts longer. So the minimum duration for a hypomanic episode is 4 days, and the minimum duration for a manic episode is at least 1 week, unless an individual's symptoms are severe enough that they need to be hospitalized. So if symptoms are severe enough to warrant hospitalization, that automatically warrants a diagnosis of mania. But if symptoms are not severe enough to require diagnosis, they need to be persistent for longer in order to be considered a manic episode. The other important distinction between mania and hypomania is the severity of the symptoms and the functional impairment associated with them. This is then relevant to the differential diagnosis of our various bipolar disorders. So our first bipolar disorder type 1, can be diagnosed when an individual meets full criteria for an episode of mania. So they exhibit a period of elevated mood, they experience at least 3 additional associated symptoms, their symptoms last for at least a week unless they need to be hospitalized, and they experience marked functional impairment as a result of their symptoms. So anyone who has met criteria for a full manic episode can receive a diagnosis of bipolar disorder type 1. This diagnosis does not require the presence of episodes of depression. In contrast, bipolar disorder type 2 is an appropriate diagnosis when an individual has experienced episodes of both hypomania and major depression. So to meet criteria for bipolar disorder type 2, an individual needs to have met criteria for an episode of hypomania, so a period of elevated mood with at least 3 additional symptoms where there's a marked change in their behavior, but they do not experience functional impairment, and they experience these symptoms for at least 4 days. But they also need to, at another point in time, have met criteria for a full episode of major depression. And that would be those same criteria that we apply to give a diagnosis of major depressive disorder. So if an individual has ever met criteria for a full episode of mania, they would not receive a diagnosis of bipolar disorder type 2. A more appropriate disorder would be bipolar disorder type 1. If they've only experienced episodes of hypomania, they also need to have experienced an episode of major depression in order to receive a diagnosis of bipolar disorder type 2. So if we had a hypothetical individual who had only experienced a hypomanic episode without any other mood episodes, they would not meet criteria for a diagnosis. They wouldn't meet criteria for bipolar disorder type 1 because their elevated mood symptoms would not be severe enough for mania, and they also wouldn't meet criteria for bipolar disorder type 2 because they would not have had that major depressive disorder. So bipolar disorder type 2 is characterized by both hypomanic episodes and episodes of major depression. Our final bipolar disorder, cyclothymia, we can think of as comparable to dysthymia, but for our bipolar disorders. So much like dysthymia was characterized by low-grade persistent depressive symptoms, Cyclothymia is characterized by low-grade, persistent, depressive, and hypomanic symptoms. So an individual can receive a diagnosis of cyclothymia when, over a period of at least 2 years, they experience alternating periods of symptoms of hypomania that are not severe enough to meet diagnostic criteria for a hypomanic episode, and symptoms of depression that are not severe enough to meet criteria for a depressive episode. So the duration of the symptoms is prolonged at least a 2-year period of time, but the severity of the symptoms is more mild. So cyclothymia is characterized by low-grade persistent alterations of mood relative to euthymia, so low-grade depressive symptoms and low-grade symptoms of hypomania that persist over a long period of time. So that summarizes the major mood disorders that we'll be talking about. So just 2 important things to keep in mind. Number 1, that our classification of the mood disorders into depressive disorders and bipolar disorders is done on the basis of where their symptoms are relative to a euthymic mood state. Also important to consider when we're distinguishing among our mood disorders, we want to consider the severity of our symptoms and the duration required for our symptoms when determining what diagnosis might be most appropriate.